But now we welcome to our stage the two newest college deans at the University of North Dakota. I say new, but both of you have actually been on our campus for a number of years. We have Maridee Shogren, who is the Dean of the College of Nursing and Professional Disciplines, and we also have Cheryl Hunter, who is the Interim Dean for the College of Education and Human Development. How about a round of applause for them? And Maridee, we're going to start with you.
Sure.
You were officially appointed into this role last December. And what challenges and opportunities, of course, have you seen at the College of Nursing and Professional Disciplines over this last year?
Thanks for the question. I think all colleges have challenges, but we've really done a great job of turning those challenges into opportunities. So when I first started, we realized that a lot of people weren't really aware of all the good work we were doing in our college, so we'd really increased our community engagement and our college outreach. Second, we saw a slight dip in enrollment when students weren't really sure that they wanted to go into healthcare during the pandemic. And at the same time, we were seeing a significant healthcare shortage in North Dakota. And so that has turned into an opportunity to work with our clinical partners, increase our enrollment, and increase our opportunities to keep our students in the state. And we have a full nursing cohort this fall.
I love it. And we'll talk more about those partnerships as we go. And Cheryl, you were more recently appointed to your role as the Dean of the College of Education and Human Development. And what do you see as the future of the college?
Sure. Thank you for the question as well. The future for the College of Education is really in providing real solutions to the challenges that our teachers, our school leaders, our health and our mental health professionals are facing every day in the field. And like myself, I think a lot of teachers go into education because they care about the communities that they work with, and our faculty do the same. They care about bringing that care and that concern and those community-based questions. And of course, they also are really concerned about providing research-based solutions and evidence-based solutions to the challenges that we're facing in the professional fields.
That's wonderful. And you both mentioned workforce shortages, both in nursing and in teachers. And Maridee, how is UND able to address the need for more nurses across the state and across the region?
Sure. Again, we can't do it without our clinical partners. So after many, many discussions that continue to be ongoing, we've increased the number of our clinical placement sites. We've developed new co-ops and new field opportunities. And this is all done in an effort to really highlight to our students all of the potential that's out in our communities. We've also taken the opportunity to really enhance our simulation education for our students, and that's working to better prepare them for the challenges they'll face immediately upon entering into practice.
Nice, and this is not just good for the students and the faculty and the school, but it's also great for the community as well.
You bet it is.
Wonderful. And Cheryl, we're seeing a teacher shortage across the state, especially in rural areas. How is UND helping to make an immediate and long-term impact there?
We are having conversations about recruitment and retention every day in our college. Is our number one conversation that we're having. And the way that we're looking at this, not only here but across the state, is number one, through building collaborations, being able to offer the amazing programming that we have here as well as across the state, face-to-face and online. And again, really thinking about how can we provide research-based solutions to the challenges that we're facing. And we're doing that by understanding the needs that our different districts are having across the state, and then by providing really content-driven examples and professional development in the areas of, just for example, STEM education, culturally relevant practice, science of reading, as well as literacy. So in providing those, we're really helping to meet the needs across the state in these areas that are critical to retaining teachers in the classroom.
And not just developing new teachers, but also your academic programs support current teachers through master's, PhD programs, and other training as well.
Absolutely.
Yeah.
Really what is important in this space is to remember with our advanced programs is that we know that content knowledge and quality instruction is the number one thing to keep teachers in the classroom. And we know that losing one high quality teacher is equivalent to losing 11 average teachers. And that has a significant impact on student learning outcomes. And so knowing that, we're trying through our master's programs, our doctoral programs, to continue to provide quality education as well as professional development, again, to make sure that our teachers have great content knowledge as well as maintain that highest quality instruction that they can in the classroom.
Nice. And then Maridee, I've mentioned the connections and how we as individuals can collectively help the greater good. Your college is working with arts and sciences on something called our behavioral health initiatives. Can you share a little bit more?
Sure, I can. The Behavioral Health Initiative has been an excellent way for 3 colleges to come together to determine what our common interests are, explore collaborative opportunities for funding, and even to share space. It's really aimed at an effort to bring UND researchers and our education community together to prepare a comprehensive plan for addressing the behavioral health needs in our state. One example of this just happened in August, and we had 3 grant teams come together, and we hosted the very first Rural Health Simulation Summit, and we brought in emergency room staff from 7 critical access hospitals across our state to learn about caring for people with substance use disorders. That's just getting us started.
Nice. And Cheryl, the sense of wonder, a big part of this sense of wonder that we hope to create at UND is cultivating engaged citizens who are lifelong learners. What are some of the ways that the college is highlighting those dynamic educational opportunities for your students?
Well, since you mentioned cultivation, I think it would be appropriate that I talk a little bit about Grow UND. Grow UND is a strategic initiative in our college that is addressing sustainability education through learning gardens, garden education. In fact, our garden is right behind the College of Nursing. And while we do grow produce, the key piece is experiential learning and experiential education. In fact, we've had preschool students, school-age students, UND students, faculty, staff, as well as community members, all engaging in programs that we're providing through Grow UND. And ideally, yes, learning is the very most important part of that, but we're also, the produce that we produce has contributed over 700 pounds of fresh produce to UND Food Pantry, which we are just very excited about being able to contribute to this piece of our college and our community.
And that's a piece that many people don't know about. We do have a food pantry here on campus that supports students who are in need of additional food that they might not be able to afford otherwise. So thanks for that great work. Folks, this gives you a great sense of how we're pursuing that sense of wonder, but also looking at the workforce needs of the state at the same time. How about another round of applause for our 2 deans